Hi, my name is Bobby Mason. I'm the Department of Family Services Housing Advocate, and I'm here today to do the webinar for how to be trauma informed in your role as a housing locator. This topic may be hard for some to discuss. Given the national prevalence rates of trauma, many of us in the room have experienced some form of trauma directly or know someone who has. The great news is that healing and resiliency, which means restoring the balance to body and mind, is possible, and each of you can play a role in your own role on others' trauma recovery journey. It's okay to take a break, get some water, stretch your legs, whatever you need to do to take care of yourself. Trauma defined. Trauma refers to experiences that cause intense physical and psychological stress reactions. It can refer to a single event, multiple events, or a set of circumstances that is experienced by an individual as physically and emotionally harmful or threatening, and that has lasting adverse effects on the individual's physical, social, emotional, or spiritual well-being. The common vernacular that most people throw around is PTSD to define trauma. However, PTSD is actually a mental health diagnosis that requires clinicians to check off several areas or components of distress. Not everyone who experiences trauma, even severe trauma, will develop post-traumatic stress disorder. In fact, only about 7% of people exposed to horrible incidents develop PTSD. The three main points that differentiate PTSD from the acute trauma that I just defined are described as in the duration of the trauma, the intensity of the trauma, and if the trauma interferes with your daily functioning. PTSD symptoms last longer than 30 days. Types of trauma. There are various types of trauma. All included here are violence, witness, exposure to violence, abuse, neglect, war zone, and refugee experiences, traumatic grief, terrorism, immigration experiences, medical trauma, and natural disasters. Our individual experiences of trauma and our responses to it are also impacted by our environments. We can address individual trauma without also addressing socialized traumas like racism, sexism, ageism, poverty, etc., also known as intersectionality of oppression. Systematic trauma contextual features of environments and institutions that give rise to trauma, maintain it, and impact post-traumatic responses provides a framework for considering the full range of traumatic phenomena. The current issue of the Journal of Trauma and Dissociation is composed of articles that incorporate systematic approaches to trauma. This perspective this perspective extends conceptualizations of trauma to consider the influence of environments such as schools and universities, churches and other religious institutions, the military, workplace settings, hospitals, jails, and prisons. Agencies and systems such as police, foster care, immigration, federal assistance, disaster management, the media, they all conflicts involving war, torture, terrorism, and refugees, dynamics of racism, sexism, discrimination, bullying, and homophobia, and issues pertaining to conceptualizations, measurement, methodology, teaching, and intervention. Although it may be challenging to expand psychological and psychiatric paradigms of trauma, a systemic trauma perspective is necessary on both scientific and ethical grounds. What can a traumatic experience do to the brain? Fight, flight, or freeze. If trauma is prolonged, extreme, or repetitive, it can physically injure the brain. The amygdala, which is also known as the bodyguard, can become stuck in an alert state. The body continues to sense danger when there is none and sends out stress response signals. The person who experienced the trauma keeps living in the moment. Long after the trauma ends, the person may become unable to separate the now safe from the then danger. When you have a moment, please visit YouTube and search for the First Impressions video. It's a video in regards to how trauma affects the brain development of young children. Symptoms. Normal reactions to horrific situations. Symptoms equal adaptations or ways of coping. They can result in challenging behaviors. Trauma symptoms. Reaction to trauma or a trauma trigger can be short-term or long-term and can include the following. Emotional. Feelings of being overwhelmed, difficulty regulating emotions. Physical. Physiological response. Survival mode, fight, flight, or freeze. Somatic complaints, stomach aches, headaches. Relational or social. Attachment, ability to connect, trust, friendships. Spiritual, hopeless, behavioral, hyper, aggressive, impulsive, risk-taking, defiant, or acting out behavior, withdrawn, or compliant. Cognitive, memory loss, confusion, inability to concentrate. Self-concept, the sense of self, self-worth, self-esteem, self in the world. Most people need help building skills to respond appropriately to triggering events. A trigger could be anything, a sound, smell, touch, etc., that reminds them of the trauma or something that they associate with it. Triggers may be unpredictable and difficult to anticipate for both the traumatized individual as well as those working with them. Consider unexpected and seemingly extreme reactions to be possible responses to trauma triggers. Just think, what are some triggers that may come up for you as a housing locator? Adverse Childhood Experiences Study, also known as the ACEs. Childhood trauma is a significant public health concern. By the age of 17, more than 71% of children have experienced a potentially traumatic event. Exposure to potentially traumatic events can have lifelong adverse effects on emotional and physical well-being. What does it mean to be trauma-informed as a housing locator? A program, organization, or system that is trauma-informed realizes the widespread impact of trauma and understands potential paths for recovery, recognizes the signs and symptoms of trauma in clients, families, staff, and others involved in the system, responds by fully integrating knowledge about trauma into policies, procedures, and practices, and seeks to actively resist re-traumatization. A trauma-informed approach can be implemented in any type of service setting or organization. Recognizing trauma does not necessarily mean diagnosing it. It just means heighten your awareness. What does it mean to be a trauma-informed housing locator? You serve an important role in the lives of clients who are in extremely stressful situations. In the midst of crisis, you are in a position to offer stability through your relationship. It is important for you to nurture and maintain the relationship and be patient as clients work towards stability and success. Bring awareness of how systemic trauma, family, cultural issues, poverty, etc., is likely impacting your clients into your work. Check your own biases and think about ways that you can manage bias from others on behalf of your clients. Be mindful. We all have biases. However, make sure you're aware of your own in order to assist your clients effectively. When someone experiences a traumatic event, there's almost always a feeling of powerlessness and a perceived loss of control. Homelessness, or the threat of it, is likely to bring up those very same feelings. Consider about how the barriers, transportation, language, intellectual, developmental, physical disability that clients might be experiencing related to finding housing on their own might bring up those same feelings of powerlessness and loss of control. Things to consider. Have warm, welcoming, and comfortable spaces. Be friendly, inviting, empathetic interactions. Awareness of how traumatic stress symptoms may manifest through physical or behavioral health complaints. Awareness of how traumatic stress symptoms may manifest themselves differently depending upon cultural factors. View behavioral challenges through a trauma lens. The behavior may make sense as a coping strategy or adaptation given what the person has experienced. Keep in mind that some standard processes and even questions that you have to ask may be perceived as impersonal, dehumanizing, scary, or even threatening. Wait times may increase anxiety and feelings of loss of control. When possible, offer clients the option to walk around the building or give them access to spaces where they can avoid sitting while their anxiety might be escalating. Policies and procedures aimed at increasing client comfort, explaining what you are going to do before you do it, offering the client choices and control over the situation as appropriate, plans for what to do if a client discloses a traumatic experience, manage your own triggers and responses to potentially upsetting material, normalize the fact that trauma can affect everyone physically and mentally, referral and or connection to appropriate community support services and resources. Don't assume that the client automatically knows. Preventing challenging behavior. Treat everyone with dignity and respect. Respond with compassion. Be aware of your own physical presence, tone of voice, volume, body language, etc. Generally avoid physical touch and work hard to maintain an even tone of voice and neutral body language. Offer choices whenever you can. Avoid power struggles. Avoiding power struggles is key. Use your motivational interviewing skills. Take a non-judgmental stance. Ask open-ended questions. Be empathetic and offer reflective responses and affirmations. Focus on problem solving instead of reacting to challenging behavior. Help identify possible solutions. Preventing challenging behavior. Remember that the person might be in fight, flight, or freeze mode. If they are answering your questions, they might not be in a place where they can hear or comprehend what you are saying. Don't assume that people have the right information. Don't assume that anything has already been explained to them. Don't assume that they understand what is going on or what they need to know or what they need to do now. When challenging behavior strikes, continue to be mindful of your own physical presence and tone of voice is a part of managing the fact that you may be triggered by aggressive, disrespectful, or otherwise challenging behavior. The person needs you to remain calm. Think about what might actually be happening to trigger the behavior. Ask questions about what is going on in a compassionate manner. Help the person regain control by validating their thoughts and feelings and offering them choices whenever possible. Calmly request that they choose from one of several workable options. Use active and reflective listening. Don't interrupt. Avoid judgment and offer advice and reassurance sparingly. Focus on providing choices so that folks feel empowered to help themselves. Remember that the person's behavior is not driven by logic. They are in fight, flight, or freeze mode and survival responses are taking over. Try some de-escalating techniques to help them manage their aggression and calm down. How are you exposed to trauma at work? Hearing stories, exposure to traumatic content, limited decision-making power or opportunity to advocate for a certain outcome. Don't always find out how things are resolved. Interacting with clients who are dealing with traumatic stress and the behavioral consequences of that. May have a hard time listening and processing information. May be angry and aggressive. May be non-responsive and checked out. Having to ask difficult questions. Requesting that clients share personal information of a sensitive nature. There are several videos on YouTube that describe what vicarious trauma looks like. How can you protect yourself? Regular use of deliberate coping strategies. Self-care. Attract and maintain social support, personal and professional. Have a personal calling to the field. Feel good about helping others. Personality traits that include emotional competencies like optimism, faith, flexibility, sense of meaning, self-efficacy, impulse control, empathy, close relationships, spirituality, effective problem solving, protective factors that contribute to resiliency. Practicing self-care. Get adequate sleep. Prioritize hydration and good nutrition. Exercise. Identify your own triggers as well as strategies to manage them. Find opportunities to connect with others. Build a support network inside and outside of work. Engage in activities you enjoy. Focus on the rewards of the job and feelings of career satisfaction. Create opportunities to debrief after particularly difficult client interactions. Sensitively and compassionately communicate the boundaries of your role to clients and stick to those boundaries. Create boundaries between work and home. Know what belongs with you and what belongs with the client. Use supervision. The helper needs help. Acknowledge that the work can be stressful and difficult. Don't be too hard on yourself. Good. Promoting future, promising future, promoting resiliency. Here's a slide that describes how to promote resiliency within yourself and your surroundings. Here are some resources where you can find more information on trauma and how it affects the brain development of a child, as well as trauma symptoms related to PTSD. Here are service provider resources within our community. Thank you for joining us today. Goodbye.